is, how does your business model differ from PT models, traditional PT models?
Yeah, so I think the biggest difference is a little bit of what we talked about as far as working directly with employers and health plans. So most PTs sort of fall into two categories for the most part. They're either working on a cash-based model, or they're working on an insurance-based model where they're receiving fee-for-service from the different groups that they work with. But instead of that model, what we've done is really contracted directly with these employers and health plans. So we have specified rates that the health plans pay us that in some cases don't even run through the claims system. They instead are invoiced directly and paid to us. And what that allows us to do is really build a better relationship with the employer and make sure that they're receiving their data back and having more transparency into what's happening with their members. And then it also gives the employer the opportunity to structure the payment model in what aligns best with the patient care. And so to do that, we've mostly aligned ourselves with a case rate based model where we get paid one flat rate to manage a patient's case for all of the visits that that patient may have, rather than the more historical fee-for-service system that most PTs operate under. And at least to our mind, that really sort of aligns with the values that we're looking for patient care to a better degree, where if you're able to resolve a patient in 5 to 6 visits, then great, you can get paid for the same amount that if it took you 10 or 12 visits to resolve that patient. And because we're held accountable to the clinical and financial outcomes as well, it sort of creates a system that really aligns best with what the employer and the patient want.
So that's the reason why you created like a case rate that's flat, is to try to hold you accountable and provide more value with less visits. That's the goal.
Yeah, that's what we feel, that when you have a case rate system in place, it allows you to be able to match the amount that you're receiving for the quality of care that you're delivering and the outcome that you're delivering, rather than just based off of the number of visits or the number of CPT codes that you're doing on a particular visit.